So we have to wait until the gallbladder or the gallstones get infected. Around 10 to 15% of adults in Europe and in the USA have gallstones. In the overwhelming majority of these people, so around 80% of them, they don't cause any problems. However, when they do cause problems, we do something about it. But if they're not causing any issues, we just kind of leave them there. Maybe monitor them in some cases, or we just ignore them. Now, if a gallstone leaves the gallbladder and enters one of the bile duct or the cystic duct and gets stuck, you can get biliary colic. So as the ducts are kind of squeezing against the stone, you can get pain. It can last from anything from 30 minutes to up to 8 hours, perhaps even longer, while that stone is kind of being pushed through. It's horrible. And if that stone doesn't get pushed through, it can lead to an infection. It can cause damage to the gallbladder. It can cause something called acute cholecystitis. But there are lots of other things that gallstones can cause. The other things are a lot rarer than this. But it can also cause things like obstructive jaundice. It can lead to bowel obstruction. It can cause pancreatitis. But these are not common. They're not as common as acute cholecystitis, but what is even more common than that is they do nothing. When people have gallstones or they've had their gallbladder out, we recommend a low-fat diet. And the reason that we don't just remove everyone's gallbladder if they've got a diagnosis of gallstones or they're found to have gallstones is because surgery inherently has risks. And yes, with advances in modern medicine, the risks are getting lower, but there are still inherent risks to cutting someone open and removing an organ.